Hello there, welcome to Dr. Sushant's anatomy tutorial. In this video, we will discuss the anatomy of the cubital fossa. So we will discuss the cubital fossa under these headings: the location of the cubital fossa, its boundaries, contents, and the applied anatomy. Now, where is the cubital fossa? What is the cubital fossa? The cubital fossa is actually a triangular space in front of the elbow joint. Okay, so it lies opposite the elbow joint, in front of the elbow joint. It's actually an intermuscular space that lies in the front of the elbow joint, as you can see in this picture. So this is the cubital fossa, right? Now, what are the boundaries of the cubital fossa? So the boundaries of the cubital fossa, we have the medial boundary, we have lateral boundary, we have, because it is a triangle, we have an apex, we have a base. In addition to this, we have a roof and floor. Okay, so it is an inverted triangle, meaning the base is directed above, the apex, the base is directed above and the apex is directed below. And because it's a triangle, so it has got an apex which is here, the apex of the triangle. This is the base of the triangle, and we have two sides of the triangle: medial boundary, lateral boundary for the right-sided cubital fossa. All right, now let us look at the boundaries. So medial boundary of the cubital fossa is formed by the lateral border of the pronator teres muscle. Okay, so this muscle in yellow color is the pronator teres muscle. So this pronator teres muscle is actually a muscle of the front of arm. It's a superficial muscle of front of forearm. So its lateral border forms the medial boundary, and this muscle here is the brachioradialis, that is one of the superficial extensors of the forearm. So the lateral boundary of the cubital fossa is formed by the medial border of the brachioradialis, and then the base of this cubital fossa, which is triangular, is formed by joining the medial and the lateral epicondyles by an imaginary line. And apex is where the two boundaries meet. So these are the boundaries of the cubital fossa, meaning except for the roof and the floor. So the medial boundary formed by the pronator teres, lateral boundary by the brachioradialis, superior border, the imaginary line between the epicondyles, and the apex is directed downwards. All right. So next, we have the floor of the roof. We will talk about the roof first. So roof of the cubital fossa is actually formed by the deep fascia of the forearm. So what do you call the deep fascia of the forearm? It's called the antebrachial fascia, right? And this antebrachial fascia is reinforced on the medial side by the bicipital aponeurosis. So we have two things here. In fact, when you go from superficial to deep, you have to count all the structures. So when you go from superficial to deep, we have the skin, we have the superficial fascia, we have the deep fascia, which is called the antebrachial fascia, and this fascia is reinforced by the bicipital aponeurosis. So these are the structures forming the roof of the cubital fossa. Right, now there are certain structures on the roof of the cubital fossa. They are superficial structures. Well, what are they? So the superficial structures on the the roof are these veins, that is the cephalic vein along the medial side and the basilic vein along the lateral side, and we have this median cubital vein which is connecting the basilic vein with the cephalic vein lying in the roof. And we also have the lateral cutaneous nerve of the forearm and the medial cutaneous branch of the forearm. So these structures lie on the roof of the cubital fossa. So what are the structures lying on the roof? We have the cephalic vein, we have the basilic vein, we have the median cubital vein, we have the lateral cutaneous nerve of forearm, we have the medial cutaneous nerve of forearm. Right, and one important aspect to remember here, the median cubital vein is separated from the brachial artery and the other contents of the cubital fossa by this structure, the bicipital aponeurosis, which lies on the roof. As I mentioned here, the fourth structure on the roof is the bicipital aponeurosis. Right, now coming to the floor of the cubital fossa is formed by two muscles. Okay, so above and medially it is formed by the brachialis muscle. Okay, so this is the brachialis muscle, right? Before it gets inserted by forming the flat tendon into the ulnar tuberosity and the coronoid process of the ulna. So upper and medial part, so you can see the medial the lateral epicondyle, the capitulum, the trochlea must be here, the medial epicondyle. So above and medially the floor is formed by the brachialis muscle, and below and laterally it is formed by the supinator muscle. All right, so this can be seen better here. Well, yeah, so brachialis muscle is seen here, that lies deep to the biceps brachii muscle. This is the pronator teres actually, so deep to this will be the supinator. It's actually a deep structure because it forms the floor. So I believe the floor is clear. Two structures form the floor of the cubital fossa. Above and medially it is formed by the brachialis muscle, okay, brachialis, and below and laterally it is formed by the supinator muscle. It's formed by the supinator. Well, so this is the floor. Now coming to the contents of the cubital fossa, right? So the contents of the cubital fossa will be exposed after retracting the boundaries of the fossa. Okay, so medial to lateral we have these structures in the cubital fossa, and they are: one, the median nerve. It lies in the medial part of the cubital fossa, and the second structure is the brachial artery, and the third structure is the biceps tendon, and more lateral to this we have the radial nerve. So these are the contents of the cubital fossa. So from medial to lateral we have the median nerve, brachial artery, we have the tendon of biceps brachii muscle, and the radial nerve. So radial nerve will be dividing here in this situation into a superficial branch and a deep branch. All right, and the brachial artery also will be dividing into its two terminal branches, the radial artery and the ulnar artery. Right, so these are the contents of the cubital fossa. All right, now let's just take a look at the cubital fossa. So what do we have here? We have the regions, and we are going to take a look at the cubital fossa. Yes, so this is the cubital fossa. Okay, so what we see here in the cubital fossa, so the roof has been exposed, the skin, fascia, etc. have been removed, and the contents of the roof have been preserved here. So along this side we have the cephalic vein. You can see this is the cephalic vein, and then we have the basilic vein. The structure is lying on the roof. Okay, so this is the basilic vein, and the two veins are connected by the median cubital vein, right? And then we have these cutaneous nerves here. This is the lateral cutaneous nerve of forearm, which is the continuation of the musculocutaneous nerve, and we have the medial cutaneous nerve of the forearm, which comes from the medial cord of the brachial plexus, right? And on the roof we also find this bicipital aponeurosis, which actually separates the contents of the roof from the contents of the cubital fossa, basically the brachial artery. All right, we also have some lymphatics there. In green color are the lymphatics, along with together with the lymph nodes. Now let me remove the bicipital aponeurosis, and what we see here, yeah, take a look at the boundary. So this is the pronator teres muscle, okay, the pronator teres, which is one of the superficial flexor muscles of the forearm, and here is the brachioradialis. Okay, so the two boundaries here, so this is the medial boundary formed by the pronator teres, this is the lateral boundary formed by the brachioradialis muscle, and the base of the cubital fossa is formed by an imaginary line extending from this medial epicondyle to the lateral epicondyle of the humerus, and the point where the pronator teres and the brachioradialis meet is the apex of the cubital fossa. Now let us look at the contents of the cubital fossa. So we have this structure here. This is the median nerve. So the most medial structure in the cubital fossa is the median nerve. Then comes the brachial artery. So brachial artery here, this interval we can see the brachial artery. The brachial artery will soon divide into its two terminal branches, that is the radial artery and the ulnar artery. So here we have the biceps brachii. So I'm removing the biceps brachii muscle so that the contents of the cubital fossa can be seen better. Okay, so let us also remove this vein so we can see the contents better. So this is the median cubital vein, so that also is removed. Now see the median nerve, this is the median nerve here, this is the brachial artery. Now I'm going to remove the pronator teres muscle. Now we can see the brachial artery dividing into its two terminal branches. So in order to see the contents of the cubital fossa, you've got to retract these muscles. So there is no option to retract the muscle, therefore I'm hiding these muscles so that the contents can be explored. So we see the median nerve, most medial structure, then we see this is the median nerve, then we see the brachial artery dividing into its two terminal branches. So here is the radial artery, this is the ulnar artery. The radial artery passes superficially and the ulnar artery passes deep. Right? What else do we have in the cubital fossa? There is the tendon of the biceps brachii muscle. Right, the tendon of the biceps brachii muscle is removed because I just removed the muscle to expose the other contents of the, yeah, we can add it, no problem. So let us add the, so where do I add the muscle? Okay, anyway, so let's just try adding the biceps brachii muscle. Biceps brachii muscle. So this muscles forms its tendon in the lower part of the, well, anyway. so we know that, right? So it is there somewhere. Okay, so the tendon, tendon of the biceps brachii muscle will be found here. So that is the most lateral structure. Right, in this picture also you can see the tendon of the biceps brachii is the most lateral structure. So medial to lateral, you have the median nerve, brachial artery, and the biceps tendon. So those are the contents. Now let us look at the structures in the floor of the cubital fossa. So in the floor, so the floor is formed by, what are the muscles formed in the floor? So we have the brachialis muscles. The brachialis muscle forms the upper and the medial part of the floor. Now this is the brachioradialis muscle. I removed the brachioradialis muscle. Now I see the supinator muscle. So this is the supinator. So the brachialis muscle above and medially, the supinator muscle below and laterally. So these two muscles form the floor of the cubital fossa. All right, so the contents, and then coming to the applied anatomy of the cubital. So before that, so the contents, we discussed the contents in this. The brachial artery divides into two terminal branches, the radial artery and the and the ulnar artery. Yeah, I want to give you a few more things about the contents of the cubital fossa, especially the two terminal branches of the brachial artery. That's the radial artery. So now this radial artery, it passes relatively superficial than the ulnar artery. All right, and the artery, as you can see, it passes downwards and laterally, and it rests on the tendon of the biceps brachii muscle, isn't it? So this is the radial artery. So you can see that it rests on the tendon of the biceps brachii muscle. In the cubital fossa, the radial artery gives you one branch that is known as the radial recurrent artery. So radial recurrent artery. So radial recurrent artery, what is it? It is a branch of radial artery in the cubital fossa. So what happens to the radial recurrent artery? The radial recurrent artery ascends, because anything that has a recurrent with it means that it goes against the gravity, it goes upwards. So the radial recurrent artery arises from the radial artery in the cubital fossa. It ascends between the superficial and deep branches of the radial nerve, right? So we have the radial nerve here dividing into its two terminal branches, that is superficial branch and the deep branch. So this long green line is the superficial branch. This short deep branch is the deep branch of the radial nerve. Now between the superficial and the deep branches of the radial nerve, we have a artery going upwards from the radial artery. That's called the radial recurrent artery. So this radial recurrent artery anastomoses with the radial collateral branch of the arteria profunda brachii, and this anastomosis takes place in front of the lateral epicondyle. Okay, so I believe you remember I mentioned that there is an anastomosis taking place in front of the elbow, and this anastomosis is between the branches of brachial artery, profunda brachii artery, the radial artery, the common interosseous artery, and the ulnar arteries. And this anastomosis takes place in front of the medial epicondyle, behind the medial epicondyle, in front of the lateral epicondyle, behind the lateral epicondyle. So one of the arteries contributing to this anastomosis is the radial collateral artery that comes from the profunda brachii after piercing the lateral intermuscular septum along with the radial nerve. And here we have an artery going upwards from the radial artery called the radial recurrent. So these two arteries anastomose with each other in front of the lateral epicondyle. So that's of the radial artery. The other artery in the cubital fossa is the ulnar artery. So it is the larger terminal branch of the brachial artery, and this artery passes deep to the sorry for the interruption. It passes deep to the ulnar head of the pronator teres. Okay, and in the cubital fossa, the ulnar artery gives you anterior ulnar recurrent artery, the posterior ulnar recurrent artery, and it gives the common interosseous artery. Okay, so from the ulnar artery we have an artery going upwards in anterior to the medial epicondyle, another artery going upwards posterior to the medial epicondyle. So the artery that goes in front of the medial epicondyle is called the anterior ulnar recurrent, and behind the medial epicondyle is called the posterior ulnar recurrent artery. Then we have the common interosseous, which is the largest branch of the ulnar artery in the cubital fossa. Okay, so these are the contents of the cubital fossa and the details of each content. Now coming to the applied anatomy of the cubital fossa, what we have here in the cubital fossa, we have the tendon of the biceps brachii. So we can check the integrity of the C5 root through the musculocutaneous nerve. The root value of what is the root value of musculocutaneous? C5, C6, C7. So this musculocutaneous nerve is actually going to supply the muscles of the front of the arm. So to check if the C5 nerve root is intact, the biceps tendon jerk can be performed. So what you do here, you ask the patient to semi-flex the elbow, right? Semi-flex the elbow, and you feel the tendon of the biceps brachii. You may ask the patient to just help you know find the tendon of the biceps brachii. So place your thumb or the index finger on the tendon and then gently tap with the hammer. Okay, and you will see that the elbow flexes because the biceps brachii contracts. So if this happens, it means that C5 root is intact. It's called the biceps tendon jerk. Next, we know that the median cubital vein is a vein of choice for intravenous injections and also to collect blood samples for biochemical investigations, isn't it? So why do we choose the median cubital vein? Because this vein is easily identified. It's because it's a superficial vein, it lies in front of the cubital fossa. It's very easy to identify this vein, and also this vein is relatively fixed because of the bicipital aponeurosis actually fixes it, and it separates this vein from the brachial artery, which lies deep to the which lies deep to the bicipital aponeurosis. So this is the vein of choice, in the median cubital vein. One, it is easily found and it is fixed by the bicipital aponeurosis. So when you try to impinge on this vein, it does not move. And then the brachial pulse. The brachial pulse is felt in the cubital fossa immediately, medial to the tendon of the biceps brachii muscle. So that's where you feel the pulse, the brachial pulse. And then injury to the musculocutaneous nerve can result in paralysis of the muscles of the anterior compartment of the arm. So all the muscles, that is coracobrachialis, brachialis, biceps brachialis, all these muscles will be paralyzed, and your supination will be weakened. Okay, it will not be completely lost because you have another muscle by the name supinator, which helps you supinate your forearm. So it will be weakened, and also your flexor muscles will also be weakened. So elbow flexion is also weakened due to the injury of the musculocutaneous nerves. That's the injury of the anterior compartment of the arm. Okay, so this should come with the should be discussed with the anterior compartment of the arm. So in this video I discussed the location, the definition of the cubital fossa, the boundaries of the cubital fossa, and the contents of the cubital fossa. So hope this video helped. Thank you very much. I really appreciate your patience. Thank you.